I'm honored to be here tonight presenting for you guys. I am the Domestic Violence and Trauma Services Coordinator for a nonprofit organization called Community Health Action of Staten Island. So obviously we're based out of Staten Island. Now with the worlds that we're in and the virtual services, we're able to reach more people because we've moved to a virtual method of meeting with people. Um, I am a licensed social worker, so I do counseling and case management with our clients, and really just doing lots of case management, lots of supportive counseling to meet the needs of each individual person, and that might change, from person to person. So that's really our goal. Community Health Action as a whole has many different programs, so we're able to refer clients to meet various different needs related to sexual health, to mental health, to physical health, all of those different things. And if we don't have it in-house, we always do our best to try and refer out and get people the help they need elsewhere. So that's pretty much what I do on a day-to-day basis. I'm really passionate about working with survivors of DV and survivors of sexual assault, and just, being an advocate and a voice and really trying to work toward making changes that are much needed in our community. So yeah, so today is Denim Day. We did lots of celebrations or events today, with the Denim Day NYC Coalition. I'm not sure whether or not you are all familiar with Denim Day and what it stands for, but the story behind Denim Day, 1998, there was a Supreme Court case where a girl was sexually assaulted. She was raped by her driving instructor. And originally, the driving instructor was convicted of rape and went to appeal, and the Supreme Court judge overturned the ruling and released the perpetrator, using the reason that the girl was wearing tight jeans. Therefore, the perpetrator, she had to have helped him take them off of her, which would have implied consent, meaning that, or assuming that she was not raped. So out of this case in 1998, sparked an outrage, obviously, especially among women. The women in the Italian parliament showed up to work the next day wearing jeans, and really kind of taking a stand. This movement kind of made its way to California, to an agency called Peace Over Violence, who spearheaded the first Denim Day event in the US. And eventually they partnered with agencies in the Bronx to create more Denim Day celebrations or events here in New York City. Chassis, the agency that I work for, is part of the Denim Day Coalition. So we take part in the planning of the events that happen for that day, and kind of really just kind of all coming together. We meet for like 6 months leading up to the day to really kind of discuss how we can work to make a change and bring awareness to the communities that we serve. And like what you said, Yuko, there's so much, sexual assault out there now, and with different populations, especially within the LGBTQ plus community, specifically with trans people, but for all people. And I read a statistic earlier today that out of 1,000 incidences of sexual assault, only 230 of those are actually reported. So that's, less than just less than 20%, almost about 20%. So that's a huge gap. And I did read another statistic that out of 1,000 perpetrators who perpetrate these acts of violence and sexual violence, 995 of them will not spend a day in jail or see any type of consequence legally. So that just kind of shows that we still have, as a community, a lot of work to do, right? To get the culture to a place where survivors can feel comfortable reporting and feel safe reporting, regardless of, their immigration status, their gender identity, their race, who, all of these different things are kind of barriers to that reporting. So that's what Denim Day aims to do, is to advocate for people, for survivors, to make, a society where people who do experience this can feel supported, but also to try and prevent this, right? But trying to put programs into the community that prevents this before it happens. And how can we do that? So that's the ongoing conversation that we've been having. And how often we see, at least in the work that we do at Chassis, and I'm sure you're all also familiar, that sexual assault and domestic violence often go hand in hand. Like you said, you go with partners, right? We often may feel like we're forced into having sex, or the actual act of sex is not things that we agree to. Like, yes, we want to have sex, but I don't want to do X, Y, and Z, right? And is that considered sexual violence? And is that something I can report and people are going to believe me? And then that whole process of having to tell the story of the incident over and over and over again. Which survivors often of sexual abuse often experience, but also of domestic violence, right? How many times things are reported, or you're still in this situation and you have to make multiple police reports, or have to go through this whole process of telling your story over and over again. And so that's kind of the work that we do at Chassis also. I would probably say between 80 to 85% of the clients that we work with who have experienced domestic violence have also experienced sexual violence in some form. And that's a big number. That's a really big number. So, really thinking about equipping our clients with the knowledge of what they can do if they feel like they have been sexually assaulted, the knowledge to protect themselves sexually if they do choose to remain in a relationship with a partner who maybe, having affairs outside of the relationship and then coming back and having sex with their partner, right? Or clients, I've had a client in the past who it wasn't safe for her to leave. She was in college. She was just trying to finish the semester. So she had a couple more months and then she could leave and leave safely. And her partner would force her to have sex with him, right? So we did a lot of safety planning around how we could possibly avoid that as much as possible. Or how we can keep her safe if she knows that that's a possibility, right? Because as we all know, as survivors of DV and as people who advocate um, for 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 our peers or other people who are experiencing domestic violence, every situation is different, right? People may choose to stay, or people may not have the means to leave. It's very easy to say just leave and go and get out of there, right? But everybody's situation is different. So at Chassis, at least, we try and be as client-centered as we can. We meet clients where they are as far as their situation, and we let the clients make the decisions on what to do next, and really giving that power to the person who has to make the decisions, right? But our main goal is to equip them with the knowledge, and a lot of what we do at Chassis does have to do with sexual health as well. So our agency offers different programs and different things to help clients to maintain their sexual safety. Has anyone ever heard of PEP or PrEP, which are two HIV preventative medications? No. So if you are sexually assaulted, or you're exposed to HIV in any way, either through sexual contacts, through a needle stick, through coming in contact with someone who has HIV, like by blood or different things like that, there's a medication called PEP, and I like to equate it to the Plan B for HIV, essentially. So PEP is a pill that you can take within 72 hours of the exposure, that you'll have to take once a day for 28 days. And that helps to prevent the contraction of HIV if you believe that you are exposed. So for, the hospitals give this to clients who have been sexually assaulted. If you do choose to have sex with a new partner and you're unsure of their status, or you find out later that they do have HIV, are HIV positive, PEP is something that someone can take to help the prevention of HIV once exposed. But like I said, it has to be started within that 72-hour window. So you have 3 days. So that's a little bit more time sensitive. And then there's PrEP, which I like to equate to the birth control for HIV. So it's a pill that someone can take daily to prevent the contraction of HIV. So for um, people who are in relationships with HIV positive partners, it's a really good option to keep themselves HIV negative. Also for clients who are unsure of their status or of their partner's status or who have multiple partners. Sometimes we do work with sex workers or, as well. There are many different risk factors, but anyone can access PrEP, and it's a good way to help ensure that you remain HIV negative. So those are two things that Chassis offers. That's something that we do hand in hand with our intakes. We try to do sexual health education and screenings for all of the clients that we meet with. I feel like talking about sex, especially as women, is a very taboo topic sometimes for many people. It's supposed to be private and you're not supposed to talk about it. But there are so many risk factors for people, and I think it's important to talk about, as well as the prevention of other STDs and STIs. So Chassis does a lot of work around sexual health education. We provide condoms for free to clients who would like them. Male and female condoms. I should have brought the condom demonstration video. We can do that another time. But many people are not aware that there are female condoms that women can insert up to 4 hours prior to sexual activity. If they're in a relationship where it's not safe to negotiate safer sex, right? Some women may not have the choice, or partners in any relationship may not have the ability to tell their partner, I want you to wear a condom, and have their partner respect their request, right?
Well, when you wear the female condom, do the guy notice it or not?
So it's very discreet. You wouldn't, it's not something that's external. So it's inserted internally. So there is a piece of it that sticks out of the vagina. So, but if they're not like really paying attention, they may not even see it. And if they do notice it, usually at that point you're in the heat of the moment, so they're not going to stop and say, take that out, right? And it's a way to protect yourself too. um so a lot of women use them. And they're not really advertised, right? It's not something you see on TV. You see all these like Trojan commercials and all these, KY warming gel and all these crazy different things, but we're not advertising female condoms as a way of protection, right? So we at Chassis feel like it's important to spread that education for women to know that they have another option to protect themselves, where they can take that control, right? So and some men actually use them too. They can be used anally, for men if they chose to. But it's more having that power where I don't have to depend on my partner to put a condom on. I can insert it myself, and I can protect myself, right? And those are also condoms that we at Chassis provide for free to clients. So we have been mailing condoms out if clients request them. So if you would like some, if you know somebody who could benefit from having some, that's definitely a service that we can provide as well, to just, to give that added layer of protection. Us at Chassis, we have a clinic as well, connected with our agency. So it's right across the street from our office. And we're affiliated with Sun River Health. So we have locations throughout the 5 boroughs, that offers HIV testing, STI testing, gynecological services. So for clients or people that who may be disengaged from care, who don't have the right insurance to be able to go to a clinic, there are ways that we can get them to be seen, at an affordable or no cost at all. So if you need to access services, or someone um, that's something that we can do. It's important for women to be checked every year, to have a pap smear every year. If you're over 40, to have a mammogram every year. I feel that I've seen a trend where especially women as they get older, there's so many other things going on and we neglect, our physical health and getting these things checked until it's too late, right? And then that's just another thing that we have to manage and pay attention to. So just as important as your physical health is and as your mental health is, so is your sexual health. um, and that's something definitely that we advocate for as well at Chassis. We offer free HIV testing. So as a result of COVID, we've actually been able to launch an at-home test kit, which can also be mailed directly to your home. Um, so if you're concerned or you haven't been tested in a really long time, we can send the test kit directly to you. There's just a quick screening that you have to do with a tester over the phone, and then the kit is mailed to you.
Okay, that's a question. Sorry. In my day, meaning like when my husband and I met
Right.
in 1992 or something, and we tried to test for HIV, and then they said that it wouldn't show up soon. So it's not like we tested today and then not tomorrow, and we can
Right.
have sex, So
Uh-huh.
that was how is it now?
The way our tests works, and you can come in person or again you can do the at-home test kit. It's a finger prick, so it's like a little drop of blood, and you have the result in 20 minutes from the time of the test. So it will tell you whether or not if you're reactive or non-reactive. So essentially, it comes up with those the T4 cells, like if there's something in your T4 cells. If it's reactive, obviously we follow up. We do a full blood panel to ensure that um, the results of the quick test is accurate, and then we link clients to services. So if there are clients who are newly diagnosed, we do have departments within our agency that link clients to care immediately. So we will do the whole package for clients. But it's important, to just know your status, to be tested, because HIV is something that's totally treatable. It's not curable, unfortunately, but there are many clients who live long and healthy lives even with an HIV positive diagnosis. um yeah, so that's pretty much all of the sexual health things that we offer. We encourage all of our clients to take advantage of whatever sexual health programs that they feel is fit for them, and we always offer the clients that if they don't take advantage right away, we're always going to be here. So 6 months down the road, a year down the road, if the situation is different and you feel like you need to access those services, they're available to you at any time. So does anybody have any questions or anything that they're curious about that they want to know more?
Yes, I have some questions. I'm
Sure.
curious about what kind of services you offer the women to heal from the emotional and the mental trauma of sexual assault,
Right.
and how you direct them and what that, I'd like to know a little bit more about that process. Like, do you just refer them to a counselor or a psychotherapist, or is someone really like doing a number of different kinds of therapies with them in order for them to really access their trauma, in their whole body and to heal that way?
Right. So unfortunately for us, our program lost some funding due to COVID. We lost about $100,000 worth of funding, so we had to downsize our program. So right now, our program, as far as supportive counseling, is a shorter term program. So we only meet with clients for about 3 to 4 months. I'm actually the counselor on staff, so we do a lot of one-on-one supportive counseling using various different trauma-informed methods, CBT, DBT, a whole bunch of different methods with clients. But the clients are always informed up front that unfortunately it is more of a short-term thing. We always try to link clients with a mental health provider if they need it and they agree to it, to kind of follow up to make sure their mental health needs are being met and to do more of that deep healing trauma work for an extended period of time. We don't have any groups running right now, but we do intend to begin groups as well for clients with a lot of, we use the Boston Consortium model, which is a group model. It's, I believe, like 30 weeks. It's a long program, but it has a lot of different activities in it, like being in touch with who you are as a woman, and really deep diving activities that get to kind of the core of a lot of the things that the women experience, that they go through, and we have found in the past that it helps for ladies, and we haven't done any men groups, so I can't speak for groups with men, but for women to kind of feel that sense of camaraderie and that they're not alone and that there are other people out there who have experienced the same things as they have. So that's something that we intend to hopefully start soon. But we always, we try to do very trauma informed work with the clients, and we always try to make sure that they're also linked to other services that are going to help them um, overcome that trauma of sexual assault, of violence in their relationships, and all the other external factors, right? Because a lot of times we see that people who've experienced DV may have also experienced violence in other areas, in childhood, or, socially in injustices within our systems. So really trying to unpack that, and to address all of it as best as we can.
I have another question.
Sure.
What this has to do with statistics. How, out of the total number of sexual assaults that are like reported, that you have facts on, what percentage of them are like rapes, and what percentage of them are like attempted assault, or somebody was, being too aggressive sexually, or they were
Right.
possibly molesting someone? Maybe it would have to do with careers,
Right.
where like a boss came on to somebody and she had to shove him away. What, I'm curious, what's the breakdown? Do you know that?
So unfortunately, I can try and look into that. I don't have a breakdown on that. But I also feel like whatever data we find, a lot of it is going to be very skewed because a lot of these things are really, really underreported, right?
Oh,
So I'm
right.
sure that there is information out there, and I'd be happy to get that information for you, because it's a very interesting thing to think about, right? Because there's so many different forms of sexual assault. It doesn't just have to be rape. But it's hard to really know concretely because there's such a big percentage that's not reported. So thinking about that, and I would be interested myself to do more research and to see, what statistics are even out there on what the breakdown is. I have done some research into like NYPD reporting for the Staten Island and 5 boroughs. But even the NYPD, they don't really categorize it well enough to be able to delineate it in that way. It's kind of just like rapes and other sexual assaults. So, I mean, at least in the public reporting that they give
That,
to the public, I don't know how they do it internally.
pardon me, but I feel like that is like saying, oh, so we're going to classify murder with guns and all the other ways you can murder somebody. They're all going to be lumped into the same thing. And it's not the same, because there are varying degrees of prosecution, and what happens with prosecution of the crime.
Mm-hmm. Definitely. And that plays a role in just in the justice system and how we try these cases and how we bring them, in front of the judge. There's so much systemic change that needs to happen.
Yes.
So it's really a difficult topic. It's a taboo topic. Nobody really wants to talk about it. It's something that, we've kind of swept under the rug in many ways. And if you're not the ideal victim or the perfect victim, you don't get the same level of of consistency, of advocacy, of just handling the case in a proper way. So there's so many different levels to this, and it's you got to start somewhere, which is why Denim Day exists. But there's so much work to be done and so much systemic change that needs to happen to
Yeah.
really make an impact.
Yeah. Yes.
Yeah.
Yeah.
Does anybody else have any other questions?
I don't have a question, but as I'm really interested in understand more about domestic violence plus education, in sexual education,
Mm-hmm.
and also the programs, because sometimes we don't know, like a
Right.
survivor and victim, what is the pro? Like, for example, if the abuser cheating the person, and about sexual education, sometimes we don't have an idea, what is the pro, what is the,
Right.
sorry, I need one.
Okay.
And so that's, this is really interesting to, to have that information, and they come together. And
Yeah.
also what is, about pre and prep is like, before I never hear, but now, like I'm educated, like, and also I'm training myself, and I said, well, that's really important, this information, and even educate to myself to share with another,
Yeah.
share the information with other people.
Definitely. And I think even society and organizations as a whole don't really link the two together. And we're also a provider at the Family Justice Center in Staten Island. So I work with other providers, and we do sexual health presentations to providers all the time. And I posed the question to them, like, how many of you talk about sexual health in your intakes with clients? And nobody, out of a group of probably about 25 plus, nobody said that they were talking to clients about sexual health. So it's a big area that we're lacking. Like, we're not giving people the education to keep themselves safe, and some women or clients, individuals, maybe too nervous to ask, right? So if we as providers or as peers or as colleagues open the floor and give the person the forum to feel safe to talk about it, we're allowing them the space to be educated and to empower themselves to make their choices, whether or not they want to choose to access PrEP or PEP, whether or not they want to choose to use female condoms, or to learn about how to negotiate safe sex, right? Because I know, at least for me, my parents didn't really talk to me about sex and the right thing, the wrong thing, what's okay, what's not. Like, you kind of learn as you go in many cultures, right? The only thing that I really learned growing up as a kid was, like, sex is no good and you're not going to have it, and that's it. But that's also not beneficial for someone who then grows up and is not sure how to talk to their partner about using a condom, or how to use a condom themselves, right? And if us as providers, or us as people in groups like this, don't make a safe space to talk about sex, then the person may not ever really know how to use a condom the right way,
Yes.
or what their options are, or that testing is so important. So that's kind of also why I do these talks, and I try to talk about it as much as possible and make it something that's normal, because realistically, everybody's having sex at some point in their life. you know
Yeah.
Hopefully it's a positive experience, but many times it's not. And knowing what's okay, what we want to do with our bodies, what we don't want to do with our bodies, knowing that it's okay to experiment, and then deciding that that's not something you ever want to do again, and just really focusing on that sexual health, because that's part of who we are as human beings. um so really even trying to just change that culture and that dynamic of us as providers opening up those conversations and leaving it out on the table. So even if the person doesn't want to talk about it in that first initial session, or in that first meeting, knowing that I'm a safe person to come and talk about sex to, or sexual health to, if a month from now something's wrong and you need help in that area. So that's
Yeah.
why I feel it's so important. And it's important for all of us to have the education, because if we have a friend who's like, well, I don't, this is happening and I don't know what to do, or I'm feeling this and I'm not sure where to go, right? Now you're all equipped with the knowledge to say, hey, I know this person who works for this agency who can get you the help you need to get tested, or to get on PrEP if you're interested, or to even just offer free condoms to keep yourself safe when having sex. So I think that even there is a place where we can start to have the conversation, and keep the conversation moving forward. So I'm just going to put my information in the chat box so you
Great.
guys all can have it.
Please.
I'm going to give you my email and my agency phone number. So if you need anything, or you are interested in services, or know someone who might be, you can feel free to send them my way, and we
Right.
will.
And they don't have to live in Staten Island
No.
or anything like that,
Mm-mm.
right?
No, if they
Okay.
have to come in person for services, we can always link them to a clinic or services in their area.
Oh,
But
right,
all
right.
of our services are being offered virtually too, so we make it work.
Okay, great. Sounds
Okay.
great. Yeah.
No,
Great.
thank you so much,
Thank you, ladies,
Rose.
for having me. It was
and
so nice to meet all of you.
Thank
you.
you.
Too.
Yeah,
Thank you so much.
Absolutely. You all have a good night. Thank
Yeah,
you.
you too.
No,
Thank
bye.
you.
Bye.
You too.